Welcome to GIIS Webinar Series. My name is Sanjeev Poudel. I am a research associate at Global Institute for Interdisciplinary Studies. In short, we call it GIIS. Today, I'll be moderating the webinar with our third speaker, Dr. Selam Ahderom. Thank you for coming to the Global Institute for Interdisciplinary Studies webinar. GIIS is a Kathmandu-based interdisciplinary knowledge-based institution. You can log in at the GIIS.org to know more about us. This is our third webinar series of the theme AI and Emerging Technology for Sustainable Futures. AI and Emerging Technology for Sustainable Future is a research group at GIIS that aims to conduct research, development, education, and public discourse on emerging technologies such as data science, machine learning, cryptocurrency, cybersecurity, augmented reality, and artificial intelligence to generate knowledge, innovate, support, and catalyze sustainable development. Our previous speakers presented on AI and sustainable discourse and on use of AI and agriculture. Our previous speaker were Professor Chip Bruce and Professor Manoj Karki. So today we have a distinguished speaker joining us from Perth, Western Australia, Dr. Selam Ahderom. Thank you, Selam, for accepting our invite to share on the theme of AI and health, which is an important aspect given the post-COVID-19 situation. Please allow me to introduce Selam. Dr. Selam Ahderom will talk on theme AI and health, focusing on medical imaging and machine learning models applied to optical systems. Dr. Ahderom is a researcher and educator originally from Africa. He has a PhD in engineering from Edith Cowan University, ECU. His interests also include collaborating with communities in a process to empower them to work for their own betterment. So Dr. Selam, we will have 30 minutes of a presentation and we will do a Q&A session. Then we'll wrap today's webinar. We're also live on Facebook. So through our GIIS web page, we will be taking Q&A from there as well. So with this, please join me in inviting Dr. Selam for his talk. Thank you. Welcome, Selam. The platform is yours. Thank you.
Great. Thank you very much, Sanjeev. Thank you very much for the invitation from the Global Institute for Interdisciplinary GIIS. Really, it sounds very interesting, and the question of sustainability is a very important question as we're thinking about technology. I'm very honored to talk with you in this topic of machine learning for improved health. I will approach just some thoughts on what are the opportunities that we have in this regard, but at the same time, I would like to talk a little bit about what are some of the potential challenges that we see in this area of improving health in our communities, and how advanced technologies like artificial intelligence, or what we're calling machine learning, contributes to alleviating those problems. So I will look at the issue of technology in general first. The reason is that it's important, it's useful to look at the bigger picture of what is technology and how can it improve life and how it can improve health in this particular case. And what are some of the ways that it can do that and some of the ways that it may not be able to do that, before we would go then into the question of what are some of the interesting ideas being applied into machine learning, to use machine learning for improving health. And then we will look at some specific areas of concern in machine learning for health issues, and then we will have a few words to conclude. Um, so I think when we think about machine learning, it's important to think that it doesn't exist by itself. That actually over the last few decades, there is a number of technological advances that have really transformed the world. And there are three relative to what we are interested in now. The first one is just the information and communication technologies, starting with the transistor, the integrated circuit, and then based on that, this information and communication boom that has happened over the last few decades, allowing us to have things like the internet, mobile devices, and all the cloud-based systems that really underpin a lot of the world economy currently. Very closely linked to that is that there is an incredible advance in manufacturing that has happened, which has a very important implication for health delivery and health innovation. This includes all kinds of computer-aided design and computer-aided manufacturing that exists, including prototyping, even though those are the ones that are hyped, like 3D printing and devices like that. But actually, the general area of manufacturing becoming much more streamlined has had an enormous impact of how we build and design advanced technology devices in the last couple of decades, especially to such an extent that you can design on your computer a printed circuit board, populate it, send it to someone, and they can, for very cheap amounts, produce for you a small device that is able to do a lot of computation and other devices that do mechanical and other types of devices as well. In that sense, then, machine learning is a more recent, maybe in the last 10 years, that it has shown an enormous amount of impact on the economy as well. And so these things are creating a lot of opportunities for creating better outcomes in health, no doubt about it. And really, we will look at a few examples, but the potential is that a lot more can be done than what has already been done. However, the first challenge or the first limitation we look at is that technology is not necessarily a panacea. It's not a solution for everything. In fact, technology in the last decade or two has been used, and those advanced technologies have been used in ways that may not be to the benefit of the vast majority of humanity. The first one, for example, one aspect to look at is at the individual level. And this is, I termed it materialism. Basically, this idea that much of our mindset and thinking revolves around purchasing and buying things. And it may seem that this is human nature, and sometimes we're interested in objects, shiny objects that we like. But the last few years, it's become very, very clear as to how much these new technologies are accelerating that process. In this case, one thing to look at is this boom in advertising technologies that exist. Some of our largest companies in the world today are really advertising companies. And the level at which they have been able to use information and especially machine learning systems in order to convince people to sell them things so that they will buy things has been astounding. They've been extremely successful in improving that. And the wealth that they have generated is a direct result of that. But clearly, that is not necessarily for the benefit of humanity. It might make it easier for some companies to be able to sell. but changing how people perceive themselves, convincing people that they will not be happy unless they have those things at their disposal, and changing kind of the priority and the focus of people comes at a very great cost. Another individual level things that have been happening is isolation. And this is the most interesting because it's kind of very ironic and maybe paradoxical. A lot of the social media technologies on the face of it are creating more connection between people. We are able to see what our friends are doing. We're able to get products and services to become aware of them. We're able to communicate with our loved ones across long distances and for much less cost to us than was possible even 20 years ago. But increasingly in the last few years, studies are showing that, especially for young people, and increasingly for all members of society, that social media use is actually taking over and creating a lot of isolation, a sense of feeling that they don't belong, that, oh, everything looks so polished and beautiful that others are doing, of disconnection from their peers, which has been very clearly linked in studies to a decrease in mental health, problems with mental health that people have been having, which is very interesting that the very thing that on the surface of it looks like is creating more connections among people, and so a good thing, actually by how they're designed and how they're implemented creates such negative outcomes is very interesting and very useful to think in terms of what we're talking about today. At the social or community level, the same thing. Even if we look at social media, it's been very clearly linked in study after study to polarization in society. And the cause of it is very clear, that the companies seem to be focusing. There was a recent paper on the MIT Review this month showing that one of the biggest social media companies in the world today, there was an interview with one of the people who designed the artificial intelligence system for that company. And he said that the company knew that the way that their algorithm makes people, the information that it gives them, especially news articles and posts of other people that it shows them, are designed to make them stay on that platform as long as possible, even though it was very clear that those things that were making people stay on those platforms were very often things that are generating hate in the community and dividing people and making people suspicious of each other. But it was very clearly something that they were prioritizing their profits over the social good, and an enormous amount of destabilization at the community level and at the national level in many countries has become very visible as a result. The same with justice at the community level, where the mistrust and division between people that is promoted by some of those platforms is creating a lot of problems for people from many, many different backgrounds. This, even though at the face of it, again, these technologies are very useful. They're only allowing people to access information. They're allowing people to access communication with their peers, with their loved ones. But at the heart of it, the way that the technology tries to guess what the person wants to hear and kind of giving them the information that they are able to advertise to them more is something that is causing a lot of problems in society. We are only at the tip of it. This is a problem that we are only becoming aware in the last couple of years, that really over the coming decades, unless something is done about it, great negative outcomes will be seen from it. At the institutional level, another example is the lack of trust. A technology was developed called blockchain, maybe in the last 2 decades, that allowed value to be exchanged, any type of value to be exchanged, but in a way where there is no centralized authority that is trusted by all the players, by all the actors in that particular system. And it was felt like this was such a technological breakthrough. But at the heart of it, the issue that it's solving is that when people don't trust their financial institutions, whether it's banks or reserve banks at the national level or national banks, that this is trying to sidestep those problems by creating a system for the exchange of value without having any centralized authority. Of course, as many people have predicted right from the beginning, this caused many issues, such as it being used for illegal purposes, because it's untraceable. Supposedly, it's not really untraceable, but it gives that sense. But it allows any player to exchange value or money with any other player around the world, allowing money laundering and so many other issues to arise. But also, even the mechanism by which it verifies every transaction has become so energy intensive as time goes, that it is said, I think a few months ago, they estimated that the amount of electricity used by the Bitcoin system is equivalent to the amount of electricity used in a large country. They said it's equivalent to about Argentina's use of electricity, which is astounding, but it's also very, very sobering, because this is only the beginning. As the value of Bitcoin rises, the amount of computation required to do this computation will continue to increase and become completely unsustainable. And this also shows how the environmental impact of generating all that electricity will have on the greenhouse effect that is affecting climates. So I think the idea that I wanted to start with is that just because the technology exists doesn't mean that it's the best way to solve a problem. We have to be very careful to be able to see exactly how does this technology advance the well-being of society, and not just assume because something is very advanced, technology is very mathematically advanced or uses components that are at the forefront of technological research, that it doesn't necessarily mean that that is the best way, that best solution for the problems that we face. Of course, we're talking about how it can be used. We see a lot of opportunities, but at the same time, we have to be careful that it is actually applicable, that it actually is the solution that we're looking for. Okay, so with that, I thought one way to look at health then would be to look at what has been the health technologies or innovations in the last 100 years or so that have made the most impact into the life of people. And so I didn't want to use my own research. I went to the British Medical Journal, and they had a supplement for one of their issues a few years ago, where they tried to ask all the clinicians in their subscribers to help them identify which technologies were the most impactful on society. And I tried to reproduce the graph that they had there. It was too big, so I just kind of reproduced it here. And One of the things that we can see from this is that, yes, some of them are based on technologies, advanced technologies like X-rays, the developments of certain drugs that required state-of-the-art organic chemistry and all that. But many of the most impactful were also low technologies like sanitation. For example, there were studies in the 1860s as to why women in maternity wards in hospitals were dying in large numbers. And it became clear that the clinicians were not washing their hands when they were going from one patient to another. And just doing that had an enormous impact on the survival of mothers in their labors. Other aspects of sanitation, other aspects of using evidence-based studies. Archie Cochrane, that it says, that published a paper in 1972 on evidence-based medicine, on how we can ensure that when doctors are prescribing, that they use actual evidence, not their opinions, but actual evidence that has been shown in clinical trials to produce the result that the doctor hopes, and how these changes have made a very large impact on society. Again, the idea of this slide is really to think that not every health problem will be solved by advanced technology. For some, it will be necessary, but we have to really keep an open mind. What is the best technology for the problem at hand? Okay, so with that, let's look at the technology development cycle. Usually in R&D or research and development, there is a very simple workflow or development cycle that we see. First, the problem is defined. What is the problem to be solved and how will it be solved, and what are the features that whatever the solution should have. And then it's developed item by item. The features are developed, whether there's software or hardware or systems or whatever they are. The solutions are developed, and then they are tested and stabilized to make sure that they meet the needs of the patients, and then they're delivered, and a maintenance and monitoring is done to make sure that they continue to give the services that or the quality of service that they need to. But there is a serious problem with this when we're thinking of the advanced technologies, the opportunities that we see in these advanced technologies. And that is that we are at a stage where we cannot define the scope very well. We're still at the very early stages of this process. So we don't quite understand how these technologies affect societies. So a more nuanced approach is needed. So this is a process that is possibly better, where we spend a lot of our time identifying needs finding, where we try to see, for example, if we were thinking of the health system in Nepal and say, how do we improve health in Nepal? We don't go with just an idea that we have, but really go down and see what, by talking to clinicians, patients, communities, health officials, and many others, really to understand what are the problems that if they were solved, they would have the most impact in society. Before we talk about any solution, what technology or anything, just what is the problem, understanding the problems and identifying from those problems, which ones can we actually realistically solve? Which ones do we understand the disease progression of, if it's a disease, or understand the process deeply enough to be able to say, okay, we can start to address this problem. So it starts from that, understanding and identifying what are the opportunities for improvement in health that exist, and understanding that deeply. Only after we have identified a problem that meets those qualities, then we're able to go to the concepts and say, what concepts can help us to solve this problem, and then be able to identify the solution process, which follows a pretty straightforward system as well. This is the system proposed by Stanford University's biodesign process. And the link is there. It's really good for people who are interested to develop solutions that actually meet local needs, to really think about this process and see how they can apply it in their realities. Okay, so with those thoughts, hopefully we see that actually we have to be careful in identifying our problems. And let's say that we have found a problem where machine learning will be a very useful tool to solve the problems. What does the machine learning workflow look like? I think many of you, if you are familiar with the machine learning workflow, this might be superfluous, but just for completeness, maybe we start with this slide. This one is from one of the companies that produces some tools for machine learning, called MathWorks, which produces the MATLAB program for engineers in the audience. This would be very familiar territory. But I just want to say that it's not necessarily that these tools from MathWorks would be the best tools to solve machine learning problems. In fact, far from it. Most of the tools that are very, very useful in this regard are completely open source tool chains for machine learning. So I just like this slide because it kind of describes the 4 areas very well. So the first part of a machine learning workflow is data. Data is the heart of a machine learning process because it's all about finding patterns and being able to learn efficient patterns and features to be able to use for some useful outcome. And they can come from sensors, from databases, from people's writings, doctors' notes, and so on. Then the next step, and possibly the longest and the most time-consuming step, is data exploration to ensure that the data is complete, that it can be validated to be true, that and be able to get some insight into statistical relationships between different points of data. And then pre-processing, probably the most time-consuming step, where the data is cleaned up to make sure that it is actually able to give us results that we can trust. And many algorithms are used in that process. Once the data is there, the heart of this process, then the model development is the next step, and which also requires a lot of modeling, which we'll come to briefly in the next few slides. And then it's deployed, whether it's in an embedded system, in a device that is in the heart of a person, that in a body of someone, or desktop apps, or enterprise systems, or cloud systems that give information to clinicians and so on. The outcome will be that. There's also many other ways of deploying where the output is just an insight that can be used to change health policy and the like. So when we look at the machine learning toolkit, there is 3 major areas of or approaches to machine learning. And some of them are using supervised learning, where we have a lot of data and we have information about what the data means. For example, they could be X-rays, and the X-rays are labeled to see what kind of disease is contained in each image. And then supervised learning, supervised meaning we know what the different data points, what kind of health condition that they point to, and then we're able to test, does that really produce on another data set that has not been seen by the training algorithm, whether it's able to detect on a completely different data set or a partially hidden set, the machine learning algorithm is producing results comparable, for example, to a doctor. Unsupervised learning is a very different approach where we have a lot of data, but we don't have a lot of labels, where we don't know what the data means. But the data itself, there's a lot of algorithms we can use to find information about subgroups within the data. We can partition the data in such a way that we're able to see, for example, in DNA or epigenetic studies, we're able to partition groups of people based on certain characteristics we see in the data. And that gives clues to doctors and is used a lot in drug discovery and many other approaches. And the third one is reinforcement learning, where a system learns because it knows something about the outcome of a particular set of actions that it takes. That is the key element of reinforcement learning system. For example, the biggest, the most famous case of reinforcement learning is a system developed by Google called AlphaGo, where because the rules of the game are known and they can be written very easily, but if we were to try to see what are the different ways that the game can proceed, all the different combinations, it is impossible for the machine to keep track of all of the possible combinations because there's just vast number of combinations possible, much larger than any supercomputer will be able to compute. And so they trained the AlphaGo system using machine learning, using reinforcement learning, simply by knowing what the rules of the game are and making the artificial system play against itself. And just by playing against itself billions and billions of times, it was able to develop an algorithm that beat the world champion in Go, which even 20 years ago, many doubted that it would ever be possible to do. This really opened the door for a new type of machine learning, which is not really a question of how much data exists, but how well we understand the outcome from a certain actions that will be taken by the agent or by the simulation system. This has been used, for example, now by Google again, by something called AlphaFold, where a very hard mathematical problem of knowing a sequence of a protein from its mRNA sequence, being able to predict what will be the shape, the three-dimensional shape of that protein, which many people had tried, and it had been a very hard inverse problem to solve. But the AlphaGo system, AlphaFold system, based on reinforcement learning as well, has come very far and has achieved the state of the art and creates an enormous amount of opportunities for clinical research, for treatment and drug discovery and vaccine discovery and the like. Okay, so when we think of then machine learning opportunities that exist, often the first things that come to mind are things like diagnosis, treatment, that we would see an image or a cardiogram or something like that and be able to say, oh, this person is having a heart attack, or this person has COVID, or whatever it may be. But what we're finding over the last few years when looking at the literature is that machine learning is creating an enormous type of solutions, many different types of solutions using novel algorithms, novel approaches. For example, like I just said earlier, drug design, vaccine design. The COVID-19 vaccines, even though the companies are keeping their cards close to their chests, it's been very clear that a lot of the vaccine development, the reason why we were able to develop the vaccines in such a short time is that drug design had used machine learning approaches to find promising candidates for the vaccines before they're tested on the lab and then onto clinical trials. Adaptive clinical trials has been another very important outcome, where trying to decide how to do the clinical trials in such a way which have enormous amount of data that comes in order to quickly be able to prove whether a particular treatment is effective or not, and be able to give evidence that is statistically sound. To many other types of solutions, policy development, what policies at the health governmental health departments level produces the most health outcomes, or at the hospitals and clinics, how can we make them schedule themselves in such a way that they use the most efficient use of resources? How do we help humans avoid errors and the like? And all of them have developed, all approaches that are coming in the last few years have developed enormously varied algorithms to solve their problems. I will mention one that is very interesting in terms of diagnosis. A few years ago now, there is a group in India that used images from the eye to be able to detect with very high accuracy, equal to a very well-trained optometrist, ophthalmologist, sorry, the incidence of two of the most common eye diseases in the country. And this system is already, just from the image of the retina of the eye, being able to detect that, and is being deployed in the country effectively already. And many such solutions are in the pipeline all around the world. So the opportunities really are not simply about diagnosis or identifying what treatment is useful, but all aspects of health can potentially be used in where machine learning can be applied, if really it's the right tool for it, of course. So I'll give a few examples that I've been working on myself with my team here in Western Australia. The first one is machine learning for optical signals that come to solve a particular problem that is very prevalent around the world, called atrial fibrillation. Atrial fibrillation is a disease where the heart beats irregularly because the electrical signals that trigger the heartbeat come from many different sources. Instead of coming from the sinus node, which really gives a very rhythmic cyclic signal, the signal comes from other parts of the atria, the top two chambers of the heart. And basically there is a treatment called ablation, catheter ablation, where a very clever system where a catheter, there's a picture of the catheter there, the tip of the catheter, it's inserted into the heart through the veins and then put into the atria, identifying exactly where those errant electrical signals are coming and burning them, very controlled burn, to see that the signals are not able to work anymore. And this disease affects between 5 and 10% of people over 60 years old. So it's an enormous problem with very, very large number of people affected by it. And it's the leading cause of certain types of stroke in elderly patients. Now, the problem with this treatment is that the doctor is for the most part blind. He cannot see where exactly he's burning and whether he's burned that spot. As you can see in the image, he's making a scar image like the shape of a 3 there, but he cannot see where he has burned and where he hasn't burned. And so our group came up with an optical solution where we integrated a fiber, an optical fiber, into the catheter, and then had an optical coherence tomography system where an interference system, the diagram is shown on the bottom left of the slide, where we are able to see into the tissue, about 1 millimeter deep into the tissue, by looking at the beam that is sent, the laser beam, the coherent laser beam that is sent, and then reflects back into our system. And we're able to get a lot of data about what is happening on that tissue. But there's a big problem with that. It's an enormous amount of data that comes in the maybe 1 gigabyte or so per second that is generated from the data that comes back. And here we see a few of the images of, for example, the left image is showing an unablated tissue, a healthy tissue, and the right, the B, is showing a tissue where the heart has been burnt, the tissue has been burnt. And we were able to use machine learning tools to be able to determine from the images what the nature of the tissue is that is on, so that it doesn't burn through, which is a very dangerous situation. If it burns through, it will make a hole right through the heart. And so this is promising to make that procedure a lot more safe for people who are undertaking that procedure. Another problem on the right-hand side, the image that shows, is that we were able to detect that before certain adverse outcomes happen in the treatment process, we're able to predict by looking at the OCT image, the optical coherence tomography image as it's described there. That allows the doctor to be able to be more aggressive in their treatment, and then when they see the signal, to be able to stop because they cannot proceed anymore. And another aspect that we've been working on is called AutoML. And this is a very, very hopeful approach to how to make machine learning apply to many areas where it has not been used up to now. One of the main ways that machine learning models, especially deep learning models, are developed is that they're developed by certain researchers who develop general purpose architectures that produce certain excellent results on certain data sets. For example, images of people or images from the internet or something like that. And then they are finessed to work on other types of data like ECGs or X-rays, MRIs, and the like. So AutoML, that we were hoping to develop some tools that would automate this whole process. Not only is the training automated, now the process of generating that model itself can be automated. Some of the tools we had used is called neural architecture search systems, but they're very difficult problems because the number of ways that a neural network can be connected is enormous, in the 10 to the power of 31 or something like that, much larger than any computing system is able to search through to find what is a better system. And so we had to use a lot of clever tools to find some ways that a machine learning system, the same algorithm that we use to train the system, can be used to find the algorithm. The particular method that we're using is differentiable architectures, where we're able to connect all the architectures with all the possible connections and then be able to have a mathematical transformation that allows us to differentiate. Differentiation is a very important aspect of the backpropagation system by which the training happens in a machine learning system. And so we applied the same thing to being able to find the better models or algorithms. And we were able to actually find that some of the generated models were comparable in their efficiency to the models that have been handmade by scientists. So that is a very promising area. Of course, automated machine learning, AutoML, has other aspects as well. How do we do the pre-processing automatically or evaluation automatically? But this is one element that we've been working in specifically for classification of heart diseases from ECG, from electrocardiogram signals. Okay, so maybe now we'll take a short while to try to identify what are some of the main issues in some aspects of the machine learning pipeline. The first one is data. Data is the most potentially or one of the most important aspects of a machine learning process or life cycle. And the problem comes not from getting the images or the data itself, because these days, all medical devices are becoming digital. And so vast amounts of data is being collected every time a doctor or a clinician is collecting, examining a patient, doing an X-ray or any other diagnosis. So a large amount of data is collected. The problem is the label for it. We need very well-trained doctors to be able to say, this is what's happening in this image and this is what's happening in this image. And that is very, very hard to do.
10 more.
Sorry, Sanjeev, can you say that again?
10 minutes more.
10 more minutes. Okay, let me be very quick. Yep. So medical data labeling is a very important problem. There's many other problems as well. Sampling, for example, gender differences in a sample is very important. Heart diseases manifest themselves very differently in women as in men. So if we are building a system that predicts heart attacks or heart abnormalities, they happen very differently. So we need to make sure that there's as many women as men in the sample of the data that we are collecting. And this has been a problem in a lot of the data set where the amount of data available is unbalanced. Ethnic variations is another thing, especially for external organs like skin cancers. It was shown in a study recently that data collected from certain populations are really not applicable. The machine learning models fail spectacularly when looking at samples from another maybe shade of skin color or something like that. So it's very important to ensure that the data comes from the population where the system will be used, and make sure that it's being trained on data and also being evaluated, even more importantly, on data from the target population. Of course, data quality and missing data is a very important problem that has many different solutions that are being proposed for it. The other is ethical issues, ownership of data, privacy of data. Privacy especially has become very big issue because there has been many studies showing that even though in the machine learning model, the specific data of individuals is not explicitly mentioned, but they have shown in a number of studies now that it is possible to infer a single patient from the machine learning model, even though that data doesn't explicitly rest in there. Because of the way that the training happens, there's a lot more information than what is intended to be there. Another one is ownership, that there is a lot of laws about sharing of medical data, and some large entities collect the data, but they don't share it with other researchers. And for good reasons sometimes, because they don't have the right to share it. But it's very necessary for developing the systems that we have. One solution to that has been developed is federated learning, where the data is kept in many different areas by different entities, but the machine learning system, one machine learning system, can learn from all the data without combining the data into one place. And other methods have been proposed as well. I would like to share one of the work that we're doing in this regard in our group is synthetic data, which many groups are developing. And a particular method that we're using is called Monte Carlo system. And we're able to generate data that looks very, very close to the real data and can be used then to train the machine learning models. Another method that is being used is called GANs, which is described there, generative adversarial networks, where a machine learning system sees a few real data and generates data that look like them and is able to become so good that it's not possible for the machine itself to be able to tell them apart. Okay. Another issue that exists is computation costs. And this only has appeared in the last few years. Computation costs are rising as the model sizes are rising. And the latest one, or the famous or infamous model, is the natural language processing model that was released a few months ago, that is able to do, that is the state of the art in language processing, which is a very important part of medical ML research currently. But it's even the training the system once cost estimated $1 million in computing costs. And so how to make machine learning more accessible has become a new question over the last 5 years or so. In the past, really, it was possible to reproduce the work of the researchers with small systems, with computer systems based on desktop with GPUs, but it's increasingly becoming untenable to do that. But a lot of research is going in the opposite direction, how to make them accessible to small computing systems. Another element of another concern with machine learning application is evaluation of the system. There's this study from last year showing that of 31 models that had been developed for detecting COVID from X-ray images of lungs, even though they had shown on the face of it good results, when rigorous statistical tools were used, they were found, 29 of them were found to be not really useful, to be applicable. And so there is really a need to use very sound statistical tools. A particular paper is described on the bottom there, that is a proposal for going through a checklist to check that our models really are giving significant and useful results. Okay, we'll skip this one. So basically, the main thrust of what I had wanted to share today was that yes, there are vast opportunities in machine learning for applying to health. Um, Access to the tools needed to develop them is available everywhere. It's democratizing the tools that are available so that we can, anybody who is interested can work, which is really exciting, which was not true 30 or 40 years ago, and definitely not even 20 years ago. The tools that are available today in machine learning and related technologies allows a lot of research to be done without a lot of tools, very expensive tools available. And there is a lot of unknown areas that haven't been explored yet. So it's very exciting, especially when we're looking at areas that are underserved by research that is in certain particular locations, and people in every country are able to work to see how to apply it into their own areas. At the same time, it's very important to keep in mind some of the challenges we described, that the solution has to really match the need of that particular problem, and not to think that a problem that is more technologically advanced will be better than a solution that is less technologically advanced. We need to see that data has to be really representative of the area that the solution is going to be applied to, and not and so basically, like the last slide, the previous slide showed, that the results are really applicable to the questions that we want to solve, and making sure that there is no very bias in the system. Yeah, thanks.
Thank you, Selam. One thing that I learned from your presentation is on even even though we have lots of opportunity from EML, we do have some cost to that as well, and also the sampling biases that you talked about. I think that's a great insight. We do have a hand raised from Dovan Rai. Please go ahead, Dovanji.
Um, Hello, can you hear me?
Yeah.
First, a lot of thanks for Dr. Selam for this wonderful presentation. It was really very all-encompassing and very insightful. So I would like to ask you in the earlier, in one of your early slides, you mentioned about, again, the opportunities and challenges where technology can give us a lot of, democratizing tool and a lot of the social, for our social benefit, but there's also these challenges in terms of lack of social trust and rising materialism. So to counter that, what do you think are the forces that can help to mitigate those challenges? Do you think more inclusion of technologies from global south, like in Asia and Africa? Do you think it could be one of the forces to mitigate the challenges? Yeah, I would like to know your opinion on this.
Yeah, thank you very much. Thank you. Yeah, I think really these are very important points that you're raising. What are the ways to mitigate these issues? And I mean, I can only give some few thoughts that I have. But obviously, this is really needs to be front and center in our thinking at the policy level, but also at the practitioners level. And the thought that I had is that one of the key areas, and I think you touched on it, is the empowerment of people in the technologies that they are involved in. That whether it's global south or anywhere, I mean global south specifically, because really many of our communities are not really part of this process of the generation or application of these technologies. And really, there is no need for that to be in the current circumstances. That is really the exciting part of it. But clearly, the question is, one element of it at least is empowerment. It's not this process of development is not something that one group of people can do for another group of people. This model really has not worked at all over the last few decades where it's been applied with a lot of good intention. And people have to be engaged themselves in determining what is the technology and what effect does it have in our community and how does it apply in our community. And they have to be part of the question of how they apply it to their communities. This really is a very, very different model from the current model of technology dissemination, where the question is people, the few people, the unicorn, as they call them in the technology world, where the one company that will produce the one app that will be everywhere, and then they control how that app is used so that they maximize their profit because they're the ones who own the technology. That model really has shown that it has so many negative outcomes. But the solution is not to stop those companies, but to ensure that we're empowering communities to be able to be engaged in identifying and using the technologies that are the most useful for them and be able to iteratively be part of that process. So I know there is a lot of aspects to it, and really many solutions are needed in that, but this I think is one of the elements that really is critical.
Thank you, Selam. Do we have another question? I see Dogon again raising. Yeah.
So if there are other people asking a question, they can go, or if there is, nobody on the line, I'll take the slot. Is that
Okay,
okay?
so
Or yeah, but
yeah,
if somebody else wants to go, they can go ahead.
no, you can go ahead.
Yeah, sorry. Yeah, I really like the talk. So I have, I'm getting over enthusiastic. So there's another question for Dr. Selam, and I think this is a very general question because we are also interdisciplinary researchers. And we read in your bio that you are not only a researcher, but you are also an educator, deeply, and a community worker, deeply, so involved in those activities. So we are in some ways living in a very like a compartmentalized and hyper specialized world, and especially in computer science, there's so much focus on the rigor, on the research and publication. So for you, how do you think your interdisciplinary background or your interdisciplinary interest have helped you, or sometimes I would not say it harmed you, but it might have cost you in the mainstream world? Or so how do you advise like a young people like Sanjeev and myself? I don't know if I should call myself young or not, but like the junior researchers. So how do we handle in this very hyper specialized world?
Well, that's a very good question. I'm not sure I can do it much justice, but it's a very good question. Um, interdisciplinary is by definition the only way to move forward in any topic that we actually are solving real problems in our communities. Because disciplines have a reason for various historical reasons. Someone is a computer scientist, someone is a medical doctor or a clinician and nurse, someone is a patient, they have personal experience of a particular health issue, for example, a health official who comes at it from a governmental point of view of policies and systems, and members of the community who are engaged in looking for the betterment of their communities. One critical element is that everybody has to be engaged in that process. Anybody who who needs to, who is affected by the community's progress needs to be involved in that. And there's a few things that are, from my experience, has been a bit of challenges. One is, for example, if somebody is funding a particular project, how much ownership should they have of the process versus the people who are actually engaging in it and whose lives it's being affecting? Because there's often a lot more emphasis given to the funding agency's priorities than the people's priorities, the people who are working in that. And machine learning or these technologies we're talking about is still the same issue applies there. So there shouldn't be, or sometimes there is a tendency to look down on people because they are not educated, for example, but are affected by the system. They have a lot to contribute. Maybe not the same thing that a medical doctor or a computer scientist is able to contribute, but their input is just as important, their contribution, and the whole group being able to arrive at a unity of thought, saying that, yes, these are the priorities, these are the parameters, these are the issues, this is how we're going to solve it, becomes possible only when everybody is talking with respect to every part of it. Never to say, oh, we know what those others need. We don't need to talk with them. We can think on their behalf. And that is where always limitations come. And I've also worked a little bit with agriculture, actually, and the implementation of programs for agriculture. And this same thing happens where there is a lot of professional levels in the interdisciplinary part. But again, it needs to extend a lot more to the people who are the most affected. In this case, for example, farmers, or in our case that we're dealing with today, health, members of the community that whose health, who are interested in the preservation of their health, and patients and the like.
Thank you, Selam. I know we can go ahead with the discussion on the AI and health theme as well. So if we don't have any question, probably we can wrap this webinar for today, and we will come with you on we have any further questions on AI and health.
Very good.
Well, Salam.
My phone number. If anybody wants to explore some of those questions more, or have questions about some of the slides or something, I'll be very happy to, if I have time to I can't promise I can respond to everything, but I'm definitely willing to explore the questions more if some people have more questions.
Sure, that's great. Thank you, Selam. Thank you for that time, and we appreciate your knowledge sharing. And we'd like to thank you from the GIIS as well. And we look forward for any collaboration we might have. Thank you very much.
All right. Thank you very much, Sanjeev.
Have a good day.
Thanks for the opportunity. Bye.
Bye.